Hi, this is your discussion on extraocular disorders, specifically on the inflammatory and infectious problem. Under this, you have your hordeolum or your stye. So when I talk about hordeolum or stye, you think of staphylococcal infection of your eyelids, specifically the glands in your eyelids. There are two kinds of stye. One is your internal and the other one is external. When I talk about internal stye, this commonly involves your meibomian gland. Okay, so this is a picture or an example of your internal stye. Okay, meibomian gland is the one that is affected. When I talk about your external stye, it is an infection located in the gland of Zeiss and Moll. Okay, so the gland of Zeiss and Moll is located here. So this is the location of your gland of Zeiss and Moll, and this is an example of your external stye. Now, when I talk about these glands, so the gland of Zeiss is considered to be a unilobar sebaceous gland, which can be found on the margins of the eyelid. Okay, the glands of Moll, on the other hand, is considered to be apocrine glands. In other words, they are your sweat glands. Okay, so glands of Moll are your sweat glands. While your meibomian glands would secrete oil, which would act as lubricant to protect the eye. Hence, if you would have problems such as hordeolum and stye, your patient would have problems on the lubrication of your eye. Because as mentioned, your meibomian gland would have a role on meibomian, and then even the gland of Zeiss and Moll would have a role on lubrication of your eyes. So what are the assessment findings for this patient with hordeolum and stye? Assessment would involve the presence of pain, localized redness and swelling, and then your abscess. So what is our management for this patient? One, the application of your warm compress. The purpose of your warm compress is to relieve the pain experience of your patient, and then other than that, to reduce the inflammatory, okay, to reduce the inflammation. Then we give your antibiotics. For the antibiotics, we commonly use your topical sulfonamides or your antibiotic eye drops. If not, there could be your systemic antibiotics. So when I say systemic antibiotics, we may give your oral doses of antibiotics. But commonly, for giving oral doses of antibiotics, it's usually also accompanied by the eye drops. Then, if there is no resolution, okay, of the deposits of pus there, you may perform your IND. IND is your incision and drainage. The next problem is chalation. So when I talk about chalation, it is a chronic local inflammation of the upper or lower lid. Okay, so it is the chronic inflammation of your meibomian gland, which either would involve your upper or lower lid. Okay, it would have external symptoms similar to your hordeolum. So it is considered to be a granulomatous sterile cyst of a known etiology. It could have external symptoms similar again to that of your hordeolum. So if we are to differentiate your chalation from your hordeolum, just take note that your chalation would be a chronic inflammation. If you're again wondering why your chalation would have almost the same manifestation as your external hordeolum, it's because they both involve your meibomian gland. Okay, however, your hordeolum is associated with staph infection, whereas for chalation, this is an inflammatory process which could be a granulomatous sterile cyst. When I say sterile cyst, meaning there is no involvement of infection. Okay, so there is just inflammation in chalation. So assessment, pain, there could be eye fatigue, light sensitivity, and then excessive tears, hard swelling of the lid and redness of the conjunctiva, and then there could be a painless lump that would remain when swelling subsides, okay? And then the tendency for it to recur. Now, what do we do for this patient because of the discomfort that your patient is having? So you can still have your warm compress. Warm compress is recommended for 15 minutes, 4 times a day. Then we can have your topical and systemic eye antibiotics. That is if there is an underlying infection. If there is none, we usually use your anti-inflammatory agents only. Because as I have mentioned, your chalation is not usually associated with infection. Then, if not, we have your surgical excision. Okay, surgical excision needs to be done. Then we have your conjunctivitis. Perhaps among the most common that we can hear of is your conjunctivitis. Okay, your sore eyes, sometimes referred to as your pink eye. Now, assessment. So when I talk first about conjunctivitis, this would involve inflammation of your conjunctiva. Okay, it is a common ocular disease worldwide, and you know that if a classmate of yours would have conjunctivitis, the tendency is that if there is poor hygiene measure, conjunctivitis will be spreading in the entire classroom within matter of day. Okay, now, Most of us would say, okay, or even the old ones would say, that conjunctivitis are commonly spread through the air, which is wrong. Okay, your conjunctivitis is spread through contact. Okay, so contact of surfaces which are infected, or contact of surfaces wherein there is a bacteria, or contact of surfaces which has been touched by the one which is infected, by the one who is infected. Okay, so what are the signs and symptoms for this patient? So you have your redness or hyperemia, you have your tearing and exudation, there will be itching and watery discharges, okay, pain, there is sensation of a foreign body as if there is something on your eye, and then photophobia if with corneal involvement. So the tendency of these patients, okay, with these signs and symptoms is for them to scratch their eye. And by scratching their eye, it increases their risk for transmitting the disease to other individuals. So it would depend on the type. The management for conjunctivitis would depend on the type of conjunctivitis. So if we're talking about viral conjunctivitis, the tendency is that it will resolve on its own. It's considered to be self-limiting. But for more severe cases, you would need your antibiotics, eye drops, and ointments. Okay? So when I talk about topical antibiotics, we usually use your, okay, let's look at bacterial conjunctivitis. So in your bacterial conjunctivitis, okay, we are using your antibiotics for up to 7 days. Okay, except for gonococcal and staph conjunctivitis, wherein the antibiotic may need to be used up to 10 days. So what are the common antibiotics that we use? So you might have heard of your terramycin eye drops. Okay, then you also have, for your gonococcal infection, you would use your 1% silver nitrate, and then you have your ophthalmic erythromycin. Okay, so in viral conjunctivitis, as I have mentioned, you don't need any treatment for this because this is considered to be self-limiting. However, one option that we can have is your vidarabine. Okay, so your vidarabine ointment. Then your cold compress may be applied, and if it is caused by your adenovirus, it is considered to be highly contagious. Okay, so we think that's the most common type of your conjunctivitis. Okay, your viral conjunctivitis, which can be easily spread. By the way, when I talk about vidarabine, your vidarabine is actually an antiviral medication. Okay, so it's an antiviral medication which is used also for your keratoconjunctivitis. So, as an antiviral medication, just like our other antiviral medications, its purpose is just to limit the replication of your virus, okay, to prevent the progression of the disease process. But, basically, it would not be able to cure the disease. Okay? Next. So what is our emphasis to our patient who have conjunctivitis? Okay, it's not simply not going to school, but these patients should be advised on proper hand hygiene, avoiding sharing of hand towels, face clothes, okay, or face cloth, and eye drops. Okay, so actually, it's not recommended even for them to use towels. What would be wise for them to use is your tissues when they are drying their hands. And whenever they will be using this tissue, this should be directly discarded to the waste receptacle. Then you also have your allergic conjunctivitis. So as the term implies, allergic conjunctivitis, meaning it's triggered by your allergies. So what are the management for these patients? We'll be using your corticosteroids in ophthalmic preparation. Okay, so common in the market are the anti-inflammatory drugs for your eye drops. Then you have the use of your vasoconstrictor agents. Okay, one example of which is your topical epinephrine solution. Okay, remember, if your patient is having allergic reaction, the tendency is for your patient to have vasodilation. Okay, so for that, your patient would manifest with redness of your eyes if the problem is in the eyes. So, we are using your vasoconstriction agent. So, your vasoconstrictor example here is your epinephrine. Okay, topical epinephrine solution. Then you would have your ice packs, and then you would have your cool ventilation. Okay, so your ice pack and cool ventilation is expected to reduce the inflammation experienced by your patient. Now, for your toxic conjunctivitis, toxic conjunctivitis is used by chemical irritants, or caused, by chemical irritants. So if ever your patient would have this, okay, eyes would contact in chemicals, you need to immediately irrigate profusely with saline or sterile water. Okay, the irrigation of saline or sterile water is expected to reduce the damage that could be done by the toxic substance that came in contact to your eye. If you will allow that, okay, or if you will delay the irrigation, you are allowing the substance to penetrate through the layers of your eyes. Next, we have your keratitis. Okay, so keratitis. When I talk about keratitis, you should remember your cornea. Okay, so your cornea, remember that clear part that covers both the iris and the pupil. Okay, so in this case, your keratitis can be caused by an infection or injury to the eye. This is also a common condition. Okay, so cause, there is ineffective eyelid closure and systemic collagen disorder. Again, ineffective eyelid closure and systemic collagen disorders. Now, assessment. So, an eye may have a non-ulcerating sterile keratitis. So, your patient will have opacity of the cornea. There is mild irritation. There is pain. There is tearing. There is photophobia. Your patient would also experience blurred vision. So for your keratitis, again, if it is a viral infection or a viral type of keratitis, vidarabine is recommended. Then you have your antibiotics. So we usually use broad-spectrum antibiotics if you're dealing with bacteria. And then the use of your eye shields, okay, to protect the eye. There are several kinds of surgery that can be done for your keratitis. Okay, so one is your tarsorrhaphy. So tarsorrhaphy here is done, okay, to partially close or partially suture the eyelids together. So if you would look at this picture, class, okay, the picture in the background there, okay, the eyelids are sutured together. So the purpose of this is to narrow the eyelid opening. So why? Okay, some types of your keratitis is secondary to incomplete lid closure, combined with the dysmotility of your ocular muscles or decreased corneal sensation. So to prevent, okay, the direct contact of the eyes to the outside environment because of the incomplete closure of the lid, one procedure that can be done is your tarsorrhaphy. So again, when I say tarsorrhaphy, the eyelids are being sutured together. And the purpose is to narrow, okay, the purpose of which is to narrow the eyelid opening. Then you have your enucleation. Enucleation may be already on severe cases. Okay, it involves the removal of the eye, which would leave the eye muscles and the remaining orbit intact. Okay, so enucleation already for severe cases because your keratitis will only be involving initially your cornea. Then we have your dry eye syndrome. Okay, so class, when I say dry eye syndrome, we commonly refer to this as your keratoconjunctivitis, Zika. So keratoconjunctivitis Zika is a deficiency in the production of any of the aqueous, okay, mucin, or lipid tear film components. In other words, the lid surface abnormalities or epithelial abnormalities related to systemic diseases may occur. Okay? So lid surface abnormalities or epithelial abnormalities for that matter. But when I talk about dry eye, okay, just think dry eye. So class, the problem is production of anything that would lubricate the eye. So may that be your aqueous, mucin, or lipid tear. Now, what are the assessment findings for this patient? So class, the tendencies that your patient would have scratchy or foreign body sensation. There will be itchiness. There will be excessive mucus secretions. There is inability to produce your tears. There is burning sensation, redness, pain, and difficulty moving the lids. And then you also have your photophobia. Okay, so these are the signs and symptoms that your patient may experience. Now, you have mentioned, or I have mentioned, by the way, that there are epithelial abnormalities that could possibly relate to your systemic diseases. Okay, so these epithelial abnormalities that would commonly manifest as your dry eye is your Sjogren's syndrome. Okay, your Sjogren's syndrome. So when I talk about your Sjogren's syndrome, it is actually an autoimmune disease. Okay, meaning it is our immune system that would attack part of our own body. Okay, due to the exaggeration of the functioning of your immune system. So in this kind of syndrome, it attacks the glands that make the tears and saliva. Okay, so this kind of syndrome would attack your glands. In this case, okay, since we are talking about dry eyes, it may possibly attack the one that produces your tears and your saliva. Okay, so that's why it's one cause of your dry eye syndrome. Okay, so what is the treatment for this patient? Would have your instillation of tears. Okay, there could be during day and night, and ointment at night. There could be cyclosporine ophthalmic emulsion. There could be anti-inflammatory medications and moisture chambers. Okay, so moisture chambers or swim goggles may be given to your patient. So class, in case you're wondering what's the purpose of your moisture chamber glasses or your swim goggles, okay, and you're familiar with your swimming goggles, but class, this is an example of your moisture chamber spectacles, okay, or your glasses. So the purpose of which is that it acts as a prosthetic device, okay, coupled to the eyeglass that would slow the evaporation of your tears from the ocular surface. So again, the purpose of which is to slow down the evaporation of your tears from your ocular surface. Okay, so that's the purpose of your moisture chamber spectacles. So class, again, this is recommended among your patients with dry eye syndrome, also among your patients who are experiencing your Sjögren's syndrome. So surgery. So you can do your punctal occlusion. So why are we doing your punctal occlusion? Plus, the purpose, remember, is that there is lack of tears for this patient. There is lack of lubrication in the eyes for this patient. So to prevent plus the tears from being drained, okay, to the system, what we are doing is you have your punctal occlusion. So your punctal occlusion is expected to allow for more tears and lubrication to be available in the eyes. Then we also have your grafting procedures. The purpose of your grafting procedures is to create an artificial graft that would allow for the lubrication also of your eyes. Then we have your lateral tarsorrhaphy. So we discussed about tarsorrhaphy earlier. So the purpose of your tarsorrhaphy again is to facilitate the closure of your eyelids. Okay, so what are the possible nursing diagnoses for this patient with inflammatory condition? Their number one problem will be the discomfort. Okay, so you can have their pain, okay, risk for injury, risk for infection, anxiety, and an altered role performance. Now, risk for sensory and perceptual alterations or visual problem, okay, is also common. So remember that they would have secretions, especially if I'm talking about conjunctivitis. Okay, also one thing that you need to consider since we're talking about the eyes is that your patient may also be at risk for fall. Next, we have your extraocular muscle disorders. We'll be discussing strabismus here. So when I talk about strabismus, okay, your strabismus is what we commonly refer to as your squint eye or your crossed eye. Okay, so we oftentimes tell this is because of the abnormalities on the eye structure, but right now we need to know that this is because of the absence of normal, parallel, or coordinated eye movement resulting in eye misalignment. So again, the main problem in strabismus is eye misalignment due to the absence of normal, parallel, or coordinated eye movement. Okay, so absence of normal, parallel, or coordinated eye movement. So there are different misalignment of your eyes. So you have your estropia and then you have your exotropia. So in your esotropia, you need to remember that this is what we commonly refer to as your cross eye. Okay, esotropia class is the inward or convergent deviation of your eyes. Okay, it is the inward or divergent deviation of your eyes, oftentimes referred to as your cross eye. On the other hand, when I say exotropia, it would mean the permanent or outside or divergent, okay, outside or divergent deviation of one eye away from the other eye. Okay, so this may be a permanent deviation of visual axis, again, of one eye away from the other eye. Other books would say outward or divergent deviation. Then you also have the term hypertropia and hypotropia. When I say hypertropia, your hypertropia is characterized by the upward deviation of the visual axis of your one eye. Okay, sometimes we say sunrise eyes. And then for your hypotropia, okay, this is the downward deviation of your eyes. And yes, oftentimes referred to as your sunset eyes. Then we also have the term diplopia, okay, diplopia and amblyopia. So when I say diplopia, your diplopia is the perception of two images of a single object, okay, your double vision. Then you have your amblyopia, okay, your lazy eye. So your lazy eye is characterized by dimness of vision without detectable organic lesion of the eye, okay, or loss of one eye's ability to see details. So what are the symptoms? So the tendency is that the eyes would be turned in or out, eyes do not appear to work together, one is going to the left, the other is going to the outward. Okay, then you have inability to judge depth correctly, so meaning they are unable to perceive that the tunnel may be deep, then poor vision in one eye. So, what are our interventions for this patient? Treatment. Okay, you would patch the normal eye. What's the purpose? Why you need to patch the normal eye? So class, your patching of the normal eye, okay, we patch the good eye to train the bad eye. Because one problem among this patient is that your patient is having, problems on extraocular muscles. Okay, so to exercise that muscle, we would want to have your patient to patch the normal eye. Okay, so that the bad eye will be trained. The doctor may recommend that the eye patch may be done over the dominant eye and for the purpose again of strengthening the muscles of the non-dominant eye. Then you have the use of your corrective glasses. The eye exercises may be done, and then surgery is done for severe forms of strabismus to straighten the eye of your patient. Okay, so if you would look at this now, this is the old position of the extraocular muscle, and then it was moved to the new position. So the purpose of that class is to realign this inward movement of your eyeballs going towards the outward movement of your eyeballs, okay, or to make the eyeball to be in the medial location in terms of the orbit. If you would look at this, since this is a concern with the inward movement of your eyeball, notice that it is the lateral muscle or the lateral rectus muscle which was altered or which was cut. Okay, so this is an example of a surgery that would involve your muscles. Okay, that would involve your extraocular muscles. Okay, so that is all for your extraocular muscle disorders. In the next presentation, we'll be talking about your corneal disorders. Thank you very much for your attention.